Believe it or not, choosing a contraceptive method is an important decision. If you choose a method that is not for you, it can lead to an unwanted pregnancy. Also, if it's not safe, it can trigger negative medical and social consequences. You also have to think about your partner and make a decision that would make you both happy. The best method is the safest method that you know you can use correctly and consistently. It is important to be realistic. During this PowerPoint, you will hear the terms typical use and perfect use. Typical use is how effective the different methods are during. There are many types of contraception available to the public, from highly effective contraception to less effective. Highly effective contraception include female-male sterilization, implants, and IUDs. Moderately effective contraception include oral pills, vaginal rings, skin patches, and injections. Less effective contraception includes male-female condoms, diaphragms, cervical caps, and spermicides. Other less effective types of contraception are withdrawing and natural family planning. Naturally family planning is monitoring your temperature and or ovulation. Let's start with the least effective methods and one of the oldest methods, coitus interruptus. This method is basically withdrawing before ejaculation. This leaves the man to have control over his urges and the possible escape of semen before orgasm. Another method is douching with feminine products in order to flush out semen. This method is ineffective because sperm is found within cervical mucus by 90 seconds and therefore it is considered too late. Male condoms, even though this prevents sexually transmitted infections and HIV, failure rate is at 3 out of 1,000 due to manufacturer error in technique, and or escape of semen. Failure rate is about 10 to 30% in the first year. Dangers for use of male condom is anaphylactic reaction due to latex. Female condom is another method, which is basically two flexible rings on each end. One attaches to the cervix, the other outside the vagina. This also prevents sexually transmitted infections, HIV, and women do tend to have more control. Unfortunately, it is considered expensive and bulky. In addition, female condoms are known for their awkwardness to use. There are no known dangers in using this condom. Vaginal diaphragm. It's considered a mechanical barrier. You put it on 6 hours prior to intercourse and keep it in place for 24 hours after intercourse. This needs to be fit by a physician and should be sized yearly. Failure rate is 15 to 20 pregnancies in 100 women. Side effects include vaginal wall irritation, pelvic discomfort, and allergies. Disadvantages are vaginal and urinary infection, toxic shock syndrome, and exposure to HIV/AIDS. Cervical cap is a small, cup-like diaphragm placed over the cervix. It's held by a suction, and this product should fit tightly, and it needs to be tailored to each individual cervix. Some women have a hard time finding or feeling their cervix and also having it. The combined hormonal contraceptive, which is a hormonal pill, is considered a moderately effective contraception method. It has many advantages and disadvantages. It prevents fertilization and prevents ovulation. Benefits include reducing risk of ovarian and endometrial cancer, benign breast disease, acne, and it also decreases PMS symptoms. About 9% have unwanted pregnancy with typical use in the first year and 0.3% with perfect use. Disadvantages include tripling the risk of VTE, especially if the person is above 35 years old and is a smoker, increases the progesterone-only hormonal pill is another type of hormonal contraceptive. How it works is it causes cervical mucus thickening and it decreases cilia activity in the fallopian tube, which prevents the sperm and egg from meeting. This is also a one-a-day pill with advantages including lactation not being disturbed with breastfeeding and less nausea than with combined pills. Disadvantage is that you may have irregular bleeding. It is less dangerous than the combined pill, but even a slight delay between taking medicine can cause pregnancy. This pill has to be taken at an exact time. A 2 to 3 hour delay can diminish effectiveness for 48 hours. Ideal candidates for this pill are smokers, estrogen contraindicated patients, women with sickle cell anemia, migraines, hypertension. Depo-Provera is also a moderately effective contraceptive choice. It is a progesterone hormone 150 milligram injection which is injected into the muscle every 3 months. It prevents ovulation from occurring and thickens and decreases cervical mucus. It also makes endometrium atrophic and not receptive to implantation. Advantages include 80% decrease in endometrial and cervical cancer and 70% reduction in sickle cell crisis frequency. There's also no estrogen in there. You have no periods and infrequent dosing. It also does improve the PMS symptoms. There is about 6% unwanted pregnancy in the first year of typical use and 0.2% with perfect use in the first year. Side effects include menstrual changes, weight gain, and headache. Dangers of the injection include reduction in bone mineral density, depression, allergic reaction. The vaginal ring is about 5 centimeters in diameter, 4 millimeter thickness, flexible ring inserted high into the vagina. No fitting by provider is needed. The ring is left in place for 3 weeks in the month and releases 2 types of hormones, estradiol and etonogestrel. The ring is removed for 1 week for menses and then it's resumed again. Advantages include no necessary fitting, 9% pregnancy rate in first year of typical use, and a 0.3% pregnancy rate with perfect use. Disadvantages include discomfort, foreign body sensation, vaginitis, and uncomfortable. The transdermal patch also falls into moderate effectiveness contraceptive method. It is the size of a small post-it, 20 centimeters by 20 centimeters, and has 3 layers. The patch is changed every 7 days, and a new patch is applied to a new skin site. This is done 3 times, once every week, and then on the 4th week, no patch is placed in order to get menses. The patch releases 3 hormones, active norgestimate, norelgestromin, and estradiol. This contraceptive method has about a 9% unwanted pregnancy in first year of typical use and a 0.3% unwanted pregnancies with perfect use. Advantages is once weekly use. Disadvantages are the symptoms are the same as combined. Implanon is a highly effective contraceptive method, and it is just as effective as sterilization. It is an implant 4 centimeters long and 2 millimeters in diameter and is effective for 3 years. It is inserted in the upper arm with a provider inserting it and removing it. Implanon carries about 68 milligrams of etonogestrel, which suppresses ovulation. It is very effective. There were no pregnancies in 70,000 users. Typical and perfect use are both 0.05% unwanted pregnancies. There are no complications other than infection on the implanted site. There also has no follow-up necessary unless they just want to check the insertion site or to make sure there's no infection. Other advantages are it decreases dysmenorrhea, there's no maintenance, it's cost effective, and there's no acne adverse effects. Another intrauterine devices are considered highly effective contraceptive methods as well. It prevents the sperm from fertilizing the egg. It also causes a foreign body effect in addition to medication that is released. It is inserted via the vagina by provider, placed past cervix with string at end where it can be felt by the patient. There are 2 types, copper T, which has a 10-year lifespan with a 0.6% pregnancy of first year with typical and perfect use. Side effects for the copper IUD is increased bleeding, anemia, and disadvantages of the copper IUD is pelvic inflammatory disease with insertion. Another IUD is hormonal based and it is called Mirena. Mirena is most commonly used and decreases menstrual loss and dysmenorrhea. Mirena has a 0.2% unwanted pregnancy first year with typical and perfect use. Mirena may cause spotting, headache, acne, and nostalgia. Advantages to both is no maintenance, cost effective, easily placed and removed with a high user satisfaction. Disadvantages to both is no protection against sexual sterilization cuts or occludes the fallopian tubes to prevent sperm and egg from uniting. Advantages include permanent, very effective, safe, quick recovery, no long term effects, cost effective, and no need for follow up or maintenance. Disadvantages include the fact that it's permanent, some have regret, expenses high at the time of procedure, and no protection against sexually transmitted infections and HIV. Essure is another type of female sterilization. It is permanent and non surgical. It is a 10-minute procedure that can be performed in the doctor's office. No recovery time is needed, and most women go home in 45 minutes and can resume their normal activities. It is 99% effective and non hormonal and can be available at no cost. Essure inserts are like stents, but instead of the heart arteries, it goes into the fallopian tube and it prevents the eggs from reaching the sperm. It is important to remember while the insert starts to grow tissue around it, birth control must be used for about 3 months. And then in 3 months, emergency contraceptive reduces a woman's chance of pregnancy after an episode of unprotected sex. Usually take it within 5 days of the unprotected sex. Three types available: Ella, which is single 30 milligram ulipristal pill; Plan B, one step, which is a single 1500 microgram levonorgestrel pill; Next Choice, which is the generic version of Plan B. Plan B and Next Choice are both available without prescription for women and men aged 17 and over. Ella needs a prescription. These pills prevent or delay ovulation and inhibit fertilization of egg and endometrium. It does not cause an abortion. Advantages include preventing pregnancy during times where condoms fail. Disadvantages include nausea, vomiting. If you look closely at this image, the right column shows the percentage of women continuing use after 1 year. It is evident that Implanon has the best response, with 84% of women continuing use after 1 year and a 0.05% chance of pregnancy. Then comes IUD with a 75 to 80% continuation of use after 1 year. Natural sterilization is irreversible and therefore has a 100% continuation rate. This image sums up contraceptive methods from the most effective all the way down to the less effective. Most effective include the implant, vasectomy, female sterilization, IUD, and then the least effective, we have the male condoms, female condoms, withdrawing, and fertility awareness based methods. On the right column, it shows how to make your methods more effective. For instance, with vasectomy, we want to wait for 3 months before we use no backup contraception. With injections, we want to make sure we're getting our repeat injections on time. Pills, you have to take it each day. Patch and ring, keep in place and change on time. Diaphragm, use correctly every time you have sex. With condoms, sponges, withdrawing, and spermicides, you have to use correctly every time you have sex. And for fertility based methods, you have to abstain